HIV now, and this is a very, very important issue because, you know, when we look at World AIDS Day and commemorating World Day here in South Africa, we still need to look at the figures as far as we've come. More than 90% of South Africans still need to know their HIV status. And this came out of a talk by senior researchers at the Council for Scientific and Industrial Research. Issues of prevention and stigma were also discussed. To tell us more about this, we're joined by Dr Makobetsa Khati. He's the CSIR's Emerging Health Technologies Competency Area Manager, and he is in our Pretoria studios this morning. It's very good to have you, Doctor. Thank you very much for being with us.
Yeah, good morning, Leanne, and also morning to your viewers.
Thank you. In terms of HIV research, how far have we come?
We have come a long way, and I think I need to quickly tell the viewers that we have actually made very good progress towards ending HIV. You will realize that this year the UNAIDS have come up with what they call the fast-track targets for ending HIV or AIDS epidemic by 2030. And the mainstay of this is ARTs, or antiretroviral therapy. Since the rollout of the ARVs, most people can live near normal lives. The life expectancy has increased, but in addition, the ARVs, they do not only allow people who are infected to live productive life, but can lower the viral set points to a level that is not transmittable. And then if you combine the ARTs with other proven methods to prevent HIV, such as condom usage, male circumcision, and prevention of mother-to-child transmission, we are indeed on the right track to reverse the tide and end the AIDS epidemic as targeted by 2030.
Yeah. All right. Let's look at quite an interesting and a very, I suppose, a hopeful development when it comes to a vaccine for HIV and AIDS, and something that's happening here in South Africa. We read it in the news recently. It's making headlines. I think the closest that we've ever come to getting anything of a preventative vaccine was a clinical trial in the United States and a Thai military vaccine. But now this has been furthered and happening right here in South Africa. We're seeing the first series of trials designed to build on the success that's passed a key test in South Africa. How far are we? I mean, the possibility of South Africa coming up with an HIV preventative vaccine?
Well, the answer is that we have made progress, but at the same time, there's still a lot of challenges ahead. In terms of the progress that we have made, we have had cumulative learning lessons on what works in terms of the HIV vaccine. From the first vaccine which was done back in 1986 in the DRC, we've actually made very good progress.
Yeah.
For example, there was the SPAMBIL study, which built on the vaccine trials which was done in the US based on what we call vector vaccine designs. They did not work, but what we know is that those vaccines, number one, they are safe in human use in the clinical trials, and they're immunogenic.
Yeah.
But unfortunately, they were not protective.
Okay.
The one that has had a very appreciable protection was the one that was done in Thailand, the RV144 study, where it had up to around 32% protection. And they're currently testing it in South Africa. And they use what we call a prime boost vaccine. And I think the main challenge in terms of getting the HIV vaccine is because HIV will always be ahead of us. You know, because HIV is it has a very rapid evolution. It rapidly divides or multiplies, and at the same time, it changes rapidly. So it's always ahead of the immune system.
Yeah.
But nonetheless, like I said, we have made several inroads, not only looking at the antibody-mediated arm of the immune system, but we're also looking at what we call the CTL response. So when someone is infected by HIV, you have what you call cytotoxic T lymphocytes that mount a challenge against the HIV and help to weaken it. And I think there's a paper which made headline news on International AIDS Day, which is a study which was conducted by Philip Golder, a group led by Philip Golder at the University of Oxford, in collaboration with researchers at the UKZN and Harvard, MIT, and in Canada. They have shown that, in fact, HIV is being watered down. It's becoming weaker. Where, number one is because there are certain individuals that have what we call host genetic factors, the HLAs. So they are able to force the virus to mutate so that it becomes weaker. When people can still get infected, but the virus is not as virulent as it was. And what does virulence mean? It means that the capacity of the virus to cause disease has been weakened. And also the ARTs, they have also exerted a selective pressure on the virus to a point that they force it to mutate. But remember, when the virus mutates, it loses what you call a fitness or selective advantage, so it becomes weak. And then when they did a study where they compared Botswana, Botswana had the AIDS epidemic before us, and they also started rolling out ART before us.
Yeah.
And if you look at the natural history of HIV, the natural history, that is when from the moment the person gets infected to the onset of AIDS, the natural history is actually increased. People in Botswana have shown that they can live much longer even though they are infected. So that actually shows that the virus eventually can be self-limiting.
Okay.
Because like from virologists have always known for years that infectious diseases in the new host are self-limiting. Because remember, it is at the advantage of the pathogen not to kill its host. Yeah. Because it needs it for it to survive and thrive.
All right. Let's have a look at people knowing their status, because as much as you talk about a vaccine and the development thereof, the bottom line is that we're still in the midst of a very big, a huge problem, and we need people to firstly know their status, and then of course to protect themselves, because that's the biggest cause of the virus spreading. In terms of home-based testing, how is that working?
It has not yet been rolled out. There are suggestions, and of course there are also concerns that, because usually now we have what you call the voluntary testing and counseling. Because there's a lot of, you need to counsel people to prepare them for when they get tested. So you can imagine sometimes when people get tested at home, they may not know how to deal with the results that suddenly they have the virus, and they may not just keep quiet, and not tell anybody that they've tested positive. So if they test at the VCT centers, we are likely to follow them up, and then also to be able to track the numbers.
Okay, which is vitally important. Let's just end this interview with a couple of, I suppose, other points that came out of the talk that you feel are very important, that people need to know, that you'd like to share.
I think, like I said, just to reiterate what I said, that the battle may not be over, but we are winning the fight against HIV because of the ARTs and other proven methods. But the most powerful weapon in the hand, in the fight against HIV, is actually in our hands. And that is changing our behaviors. The question of stigma, and also being tested. Again with this targets to reverse the HIV or eliminate AIDS by 2030, we have what you call 90, where 90% of individuals who are HIV positive, they ought to know their status. And of those 90% who know their status, 90% must be on ARTs, and those who are on ARTs, at least 90% must have their viral load lower to a point that it is no longer transmitted to infected individual. And this is in line with the vision to have 0 new infections, 0 AIDS-related death, and 0 discrimination.
Okay, let's leave it there. Thank you for talking to us here on the program. Dr. Makobetsa Khati is from the Council for Scientific and Industrial Research. Let's take a break.